What makes Jessa Duggar's DNC procedure different from other abortion procedures? In a nearly 19-minute YouTube video on Saturday, Jessa Duggar Seawald disclosed that she had a devastating loss during her most recent pregnancy. The 30-year-old 19 kids and counting alumna stated she made the decision to check into a hospital in order to have a dilation and curettage surgery, DNC, abortion in order to remove the baby from her womb due to the dangers associated with passing the pregnancy at home. Although abortions may be carried out in a variety of ways, a DNC is not the same as other abortion procedures. In a surgical process known as dilation and curettage, the cervix is opened, and the baby is removed from the uterus by suctioning or scraping the lining using a tool called a curette. A DNC is a first trimester surgical abortion performed in a doctor's office, according to Dr. Catherine White, an associate professor of OB/GYN at the Boston University School of Medicine and a gynecologist who specializes in miscarriage treatment. First, the cervix is opened by stretching the natural opening, dilation, with a series of dilators, Salon reported. The pregnant tissue is then suctioned out by the provider, who is often a doctor, using an electric vacuum, curettage, or a hand tool. While the majority of physicians today utilize a vacuum to remove pregnancy tissue, the surgery is still known as a suction curettage or simply aspiration. Traditionally, a curettage is carried out by scraping the uterine lining. The procedure known as dilation and evacuation, DNE, is a surgical abortion performed when a pregnancy enters the second trimester. Similar to a DNC, a DNE technique involves using additional surgical equipment, such as forceps, to remove tissue since it is performed later in the pregnancy.